My name is Jacob Perry, and this is a biopsychosocial review of sleep disorders. An intro to sleep disorders, real quick. According to the textbook Taylor and Stanton, approximately 50 to 70 million Americans report suffering from one of the three major sleep disorders, one out of the three. And on average, adults in the US sleep around or less than 7 hours a night. The three major sleep disorders are chronic insomnia, sleep apnea, and narcolepsy. Diving into the three major sleep disorders a little bit more, chronic insomnia is marked by individuals who struggle to fall asleep, stay asleep, or get good quality sleep. And diagnosis for chronic insomnia guidelines are 3 nights a week struggling to sleep for at least 3 months in a row. For sleep apnea, that is essentially when individuals struggle with breath stopping and starting repeatedly during their sleep. And narcolepsy, last but not least, is marked by daytime drowsiness that is overwhelming the individual to the point where they randomly are falling asleep suddenly during the day. Now, getting into the causes, the etiology of sleep disorders, starting with biological factors. First and foremost, a lot of these psychological factors like anxiety, stress, depression have physiological side effects, primarily anxiety. Anxiety affects sleep through the increase of muscle tension through the autonomic nervous system. So, muscle tension, sweating, all those physiological factors play into discomfort and make sleep harder to essentially get good sleep. This phenomenon occurs, as I said before, because of the psychological effects of anxiety, for example. Continuing on the biological factors, just to give an example of a biological factor that actually has complete biopsychosocial factors that play into it is cancer, specifically cancer treatment. Chemotherapy can lead to sleep disorders. That was pointed out in Yu et al. Study in 2025. Essentially, studies have shown that 60 to 80% of cancer patients report sleep disorders during chemotherapy treatment. This is a result of both the physical strain of the cancer and the treatment, the chemotherapy itself, but also how they psychologically and biologically exacerbate pre-existing anxiety and or depression conditions. So there are biological and psychological factors that are into play here. As far as evidence-based treatment goes for this specific situation, psychological support is one of the main aspects that help the individual to self-regulate. Peer and family support also alleviates psychological stress associated with cancer treatment via means of emotional connection and communication. This also has sociological support aspects to it as well, and that is essentially enhancing the availability of both family and social support systems available that help provide emotional comfort and in turn alleviate patients' feeling of isolation and helplessness in their treatment. And that was also pointed out by the same study. Genetics are another factor that biologically play into sleep disorders. For example, a study by Yi et al. In 2025 pointed out that the PER2 gene, which regulates circadian rhythm, our wake sleep patterns, if there is a polymorphism on the PER2 gene, there has been identified as higher risk factors for developing sleep disorders. So essentially, those who express any kind of malfunction at that gene, the PER2 gene, they're more likely to experience issues with sleep. Now, shifting gears now into the psychological factors, beginning with stress. So, stress can amplify pre-existing mental health conditions such as depression, anxiety, and sleep disorders, but also perceived stress can lead to impaired sleep quality. So, stress itself, but also how one perceives their stress in their life. Anxiety. Anxiety is basically highlighted in several studies as a correlated symptom that leads to sleep disorders. Noruzi and Sojai in 2025 highlighted that poor sleep quality is positively correlated with depressive and anxiety symptoms, along with Cantal in 2024 also finding positive moderate correlations of sleep score with anxiety symptoms. And then Zhao et al. In 2024 as well found surmounting evidence indicating that cell phone dependence is linked to a variety of psychological and behavioral issues, including anxiety, stress, and reduced sleep quality. So there are other factors that also play into increasing anxiety, such as cell phone dependence. Occupational stress, a little bit different than just general stress. This is typically in the workplace, and it has been shown that employees in high occupational stress environments and adverse work environments have poorer sleep quality and more likely to have a sleep disorder problem. Occupational stress essentially causes this issue by lowering the body's self-regulatory functions, resulting in bodily dysfunction and thereby leading to poor sleep quality. And depression alone, a study by Yi et al., the one that we've been going over already a couple of times, they studied essentially 1,994 mental workers and found a positive correlation. Essentially, those who claimed depressive symptoms in that group of 1,994 mental workers, over 75%, so 76.21% reported incidents of sleep disorders. So depression has been positively correlated with sleep disorders as well. Now, moving into the sociological factors that play into sleep disorders, social trust. So, social support, sociological factors aren't taken into account as much as the psychological and physiological factors that cause sleep disorders, namely just because there's so many more psychological variables that could play into sleep disorders, along with physiological that we overlook sociological factors. Just to give an example, traumatic events such as natural disasters can leave people, in a very bad situation and have lasting impacts on individuals sociologically. A study by Sugawara et al. In 2020 demonstrated that a lack of social trust is a great predictor of sleep disorders. Essentially, what they did was is they looked at a group of people who were affected by the Great East Japan earthquake back in 2011, and they were able to discover that 6 years down the line, their lack of social trust was predicting sleep disorders up to 6 years later. This comes about essentially because in a situation of a natural disaster, for example, many people are displaced, social connections are disconnected, people are geologically displaced. So the sense of social support is completely ripped away from people. And when that is completely ripped away, people have a lot more issues with stress, anxiety, depression, and thereby sleep disorders are able to thrive a little bit easier. Some common assessment instruments used to assess sleep. So, sleep diaries and sleep studies are common, and that was pointed out by the textbook, Taylor and Stanton. Some of the common tools used to measure brain waves are polysomnography, which measures brain waves, blood oxygen, heart rate, breathing, and any movement from the eyes or legs during REM sleep. The main sleep instrument used to measure sleep reports is the Pittsburgh Sleep Quality Index. So this is basically just a self-report questionnaire that's used to assess sleep problems. And then another sleep questionnaire that I found in my research, it was called the Mini Sleep Questionnaire, the MSQ. This is a 10-item self-reported Likert scale ranging from 1, never, to 7, always. Some of the instruments used to assess stress are perceived stress scale, the PSS-14. This measures perceived stress via 5-point Likert scale. Scores range from 0 to 56, with higher scores indicating higher levels of stress. Depression anxiety scale is also used for stress as well. This is the DASS-21. This is a self-reported Likert scale questionnaire as well. To assess anxiety, the self-assessment scale for anxiety, SAS, is used. 20 items covering a variety of anxiety symptoms were used to measure anxiety. GAD-7, the Generalized Anxiety Disorder Scale, is also used to measure anxiety. This has participants rate each item on a 4-point Likert scale ranging from 0 to 3. A total score of greater than or equal to 5 indicates anxiety. To measure depression, the Patient Health Questionnaire, PHQ-9, is used, measures depressive symptoms, consists of 9 entries. Each entry is rated on a 4-point Likert scale from 0 to 3. A total score of greater than or equal to 10 indicates depression. Some common evidence-based treatments. One of the main psychological and physiological, but also sociological treatments used, so covering the entire biopsychosocial model, is CBT, or in this specific case for sleep disorders, CBTI, chronic, or excuse me, cognitive behavioral therapy for insomnia. So essentially, that was brought up in the textbook by Morin et al. In 1993. That was coined. And basically, there's just a surmountable evidence of effectiveness in both general populations and specific clinical situations for CBT to have positive effects on sleep quality. Essentially, this consists of cognitive restructuring, sleep restriction, mindfulness, and also stimulus control. Those are standard practices, all of which play into the biopsychosocial model. Some other evidence-based treatment that is also in play, but also being worked on, is physical activity. This is specifically measured with the physical activity level scale. This measures intensity, duration, and frequency. And obviously, this is compared against reports of sleep quality over time to compare how physical activity impacts sleep disorders over time, along with stress, anxiety, and depression. Physical activity has had a direct negative effect on sleep disorders, as Zhao et al. Pointed out in their study in 2024. It has been linked to improved emotional state and mood, and indirectly enhances sleep quality by alleviating anxiety, which is essentially when the process of the autonomic nervous system is shut down, muscle tension is reduced, and we're able to relax. This is also happens. Physical activity also mediates sleep by reducing cell phone dependency. Zhao et al. Found out in their study as well that as activity level increased, cell phone dependency decreased, and over time that also improved sleep quality as well. Another evidence-based treatment that has been studied and has some surmounting evidence surrounding the positive effects on sleep quality are magnesium supplementation. Research supports that dietary supplementation can aid in improving sleep quality, but specifically magnesium supplementation, and it's somewhere over 500 milligrams is recommended in patients after heart surgery, as reports show that magnesium supplementation increases anxiety and depression decrease, and sleep quality improves over time. So essentially, by supplementing magnesium and engaging in physical activities, individuals can change their heart rate variability and reduce stress to improve quality of sleep. In summary, when observing the causes and effects of sleep disorders from a biopsychosocial point of view, there are quite a few factors to consider that play into both development and treatment of sleep disorders. The primary psychological factor leading to sleep disorders, there's not really one primary psychological factor, but anxiety, stress, and depression coupled together to certain levels are main predictors of sleep disorders psychologically, and then physiologically as well, because they all have factors that play into the biological part of sleep as well. As we spoke about earlier, anxiety, increasing autonomic nervous system function, sweating, muscle tension, those are the physiological factors that anxiety, stress, and depression end up invoking. Same thing as with the chemotherapy patients, the stress of both cancer and treatment on top of just like not knowing if you're going to live, that creates more physiological pain and psychological pain, and it kind of just loops and makes it more strong on both ends. And then as far as sociological factors go, the primary things that play into sleep disorders are one's relationship with sleep, as social norms can influence one's relationship with sleep, but also the level of social trust one feels in their community. As we covered with the situation of the natural disaster in the Great East Japan earthquakes, if level of social trust is all of a sudden completely taken away, then that can predict sleep disorders as well. So, in conclusion, as a whole, the United States is in a state of significant sleep health crisis. This entails a ton of profound unseen economic costs, as underdiagnosed persists to this day. And even though there are major efforts underway to improve this situation and awareness, sleep disorders do remain a serious and growing public health concern to this day. Thank you very much for watching this presentation, and this class has been awesome.